discuss the National Provider and Plan Enumeration System, NPPES. When did it come into existence? Well, first of all, one of the administrative simplification provisions of the Health Insurance Portability and Accountability Act of 1996, in other words, HIPAA, and this is going to be Title II of HIPAA. So it required the Department of Health and Human Services to adopt a national standard for uniquely identifying healthcare providers. The purpose of these provisions was to improve the efficiency and effectiveness of the healthcare transmission of administrative healthcare transactions. The final rule adopting the NPI as the standard unique healthcare identifier for providers was published January 23, 2004, and became effective on May 23, 2005. All HIPAA-covered entities had to be in compliance with the NPI provisions by May 23, 2007. That was 2 years after it became effective, except for small health plans, which were given an extra year. Previously, every payer had its own identifier for each provider or supplier, which made it difficult and inefficient to submit healthcare transactions. So if you recall, and in some cases still to this date, payers still have provider identifiers. They still can use those, but they cannot be required on a transaction or claim going forward from the date of when the NPI became effective, or they had to comply with it, which was May 23, 2007. So what is the NPI used for? The NPI basically replaces all healthcare provider identifiers that were in use as of that point in time in 2007, prior to HIPAA Act 2 or Section 2, and basically all healthcare providers who are HIPAA-covered providers must obtain an NPI to identify themselves today through because of the HIPAA transactions and requirements. Covered organization healthcare providers are responsible for determining if they have any subparts that need NPIs. If there are subparts that need NPIs, the covered healthcare providers must ensure that the subparts also obtain their own NPIs or must obtain them for the subparts. So let's talk a little bit about, before I get into explaining what a subpart is, let's talk about a Type 1 NPI and a Type 2 NPI. So a Type 1 NPI, basically the easy way I explain it is that a Type 1 NPI is tied to a human being, a social security number. That is what a Type 1 NPI is for. So if a human is going to become any type of clinical provider/supplier, and Medicare determines a human being to be a supplier, as well as group practices and things like that. A provider is actually a healthcare organization or facility in Medicare's eyes. A Type 2 NPI is tied to an EIN, an employer identification number. So we can't really say tax ID because a social security number is a tax ID. So a Type 2 NPI would be any type of organization that is created that is going to be billing for services. And that Type 2 NPI is going to be utilized on a claim form in a couple of different places. It's not going to be the rendering provider because a Type 2 organization isn't somebody that can provide services. The only time the rendering provider would be, a Type 2 NPI is, well, there wouldn't be a time because it's always going to be a human that actually can order services and can provide services. So even in an MRI facility, you're still going to have the MRI facility that's going to bill for the services. So that Type 2 NPI would be in box 32, which is the location NPI, as well as box 33 on a claim form, which is the billing provider or supplier NPI. The rendering provider is still going to be probably the radiologist that's actually reading and interpreting the MRI. So that's what a Type 2 NPI is for. The Type 1 NPI is always going to be in box 24J as a rendering provider, or could be the attending or ordering provider as well. You don't want to enumerate, and that is the process of obtaining and being issued a new NPI. You don't want to enumerate multiple NPIs unless those NPIs are specifically going to be used for billing purposes. So let's say, that you're going to utilize those NPIs and you wanted multiple NPIs. Let's say you're a hospital and you have several different practice locations and they're all different by specialty. So let's say you have an orthopedics group and you want an NPI that you're going to be billing for under that location for that orthopedics group. It may still be the same tax ID, but all operating under the same tax ID, all those practices would be. But then you need a separate NPI under that main NPI that would be a subpart. So let's discuss subparts initially. So HIPAA-covered entities are legal entities. Often a healthcare provider or supplier, that is an organization, may be comprised of components that function as healthcare providers somewhat independently of the parent, the covered organization healthcare provider, of which they are a part. These components, which we call subparts, might conduct their own HIPAA standard transactions. And this might be certified by the state separately from their parent, or might be located at the same location or at a different location from their parent organization. So as I stated before, let's say you have a large multi-specialty practice under a tax ID and they have 15 different locations, and each location is maybe separated by the specialists that work there. So you may have a primary care location, an orthopedic location, a neurology location, and so on. And you want to bill those separately. Well, you would obtain a separate NPI, and in NPPES, you would identify that as a subpart from that tax ID.